attributable to COVID-19 is also up. 21 new COVID deaths reported today versus just 10 in mid-July. These are alarming facts, but what is most concerning to me as Secretary of Health is that the number of cases among Pennsylvania kids between 0 and 17 years old rose by 277% between mid-July and August 28th. Let that sink in for a second. That's nearly a 300% jump in about 6 weeks here in Pennsylvania. And remember that nearly half of those kids are not yet old enough to get the vaccine. The reason for this dramatic jump in cases is the Delta variant, which now makes up more than 98% of the COVID cases in Pennsylvania. This mutation of the virus is extremely powerful and highly transmissible. There is no doubt that the 3 safe and effective vaccines that are readily available across the state are the best chance we have at stopping COVID-19. Fortunately, we are seeing an increase in vaccinations over the past 4 weeks. Since mid-July, 340,000 more folks are fully vaccinated. And we're averaging more than 17,000 Pennsylvanians every day stepping up to get vaccinated. Unfortunately, the Delta variant is spreading faster than the people getting vaccinated. Now, as students are heading back into this classroom for the new school year, we need to take extra steps to protect them and preserve in-person education, along with Friday night lights and extracurricular activities. We all want to keep our schools open, maintain in-person learning, allow sports and other activities to continue. Unfortunately, we are already seeing evidence that students in schools where masks are optional are suffering the consequences of not following the public health recommendations from the CDC. Just last Friday, the lights were off and football fields were empty at Pleasant Valley School District in the Northeast, Panther Valley School District in the Lehigh Valley, Annville-Cleona School District in Lebanon County, and Eastern Lancaster County because of COVID cases at Susquehanna High School's team. Those are just a few examples of the impact on students so far this school year. In many states, students went back to school earlier than they're doing here in Pennsylvania. According to some national media analysis, over 90,000 students across 19 other states had to quarantine or isolate in the first couple of weeks of this school year. Last week, the United States Department of Health and Human Services was reporting that more than 1,400 COVID-19 patients were hospitalized in pediatric units across the nation. Here in Pennsylvania, just since school began reopening, more than 5,000 students have tested positive. We've also heard from parents of students with disabilities who need in-person education. Their kids' health is in jeopardy by the district ignoring the CDC's masking recommendations in schools. We know from the CDC guidance that there is less need to remove students from the classroom if the students are vaccinated and if they are properly wearing a mask. As you heard a few minutes ago from pediatrician Dr. Hecker, science has shown us that masking in school buildings is the best way to keep students in the classroom this year. That's why today I am issuing an order requiring universal face coverings inside all K-12 school buildings and childcare providers effective 12:01 a.m. on September 7th. This order is necessary and appropriate to protect children and students from the spread of COVID-19 and made under the authority granted in the Disease and Prevention Control Law, the Administrative Code of 1929, and the Pennsylvania Code. The order is posted on the Department of Health's website and applies to all pre-K to 12 school entities and licensed child care providers, including public K-12 schools, brick and mortar or cyber charter schools, private or parochial schools, career and technological centers, intermediate units, pre-K counts programs, Head Start programs or preschool early intervention programs, private academic nursery schools, and locally funded pre-kindergarten activities, and child care providers licensed by the Department of Human Services. Under this order, each teacher, child, student, staff, or visitor working, attending, or visiting a school entity shall wear a face covering indoors, regardless of vaccination status. There are 8 exceptions outlined in Section 3 of the order online. The order shall not impact the obligation of all school districts to comply with requirements issued by the CDC, including requirements for masking on school district transportation. We know there will be objections to this action. We are asking folks to keep it in perspective. Last year, when there was this level of community transmission, our students were learning virtually. The guidance has evolved based on lessons learned. Our goal is to keep students in classrooms and keep the surging Delta variant out. It's clear that wearing masks in school buildings helps preserve in-person learning. Now we'll hear from the Secretary of Education, Noe Ortega, about why we need to keep students learning in person this year.
Thank you, Secretary Beam. I'm pleased to be part of today's press conference announcing a masking order for PA schools. Schools across Pennsylvania are preparing to reopen, or many of them have already opened, for in-person teaching and learning. Unfortunately, as been discussed today, we're also seeing a number of schools across the nation already begin to close due to COVID-19, and Pennsylvania is no different. I can't stress this enough. It is our duty to do everything possible to minimize the transmission of COVID-19 in our schools and maximize the opportunities for students to safely learn in person. Acting Secretary Beam's masking order, especially when layered with mitigation strategies like COVID-19 vaccines and testing, will help our schools reduce the spread of COVID-19, protect their communities, keep students and educators where we know it's vital for them to be, teaching, learning, and growing together safely in the classrooms. Let me also take a minute to remind everyone just what this mask order is trying to preserve. Classrooms and schools represent more than just a safe and helpful space or place for students to learn. The mask order will also ensure that we can sustain essential services for students. Face-to-face interaction can help students with the support of social and emotional well-being and their development as well. For many students, schools offer the only access to healthy meals as well. And let's not forget the person-to-person interaction that many young children have shared with me personally during my visits to the schools that they long for tremendously. We cannot let COVID-19 and the highly transmissible Delta variant take these things away from our children, many of whom are too young to get the COVID-19 vaccine. If children have to leave school to quarantine, this affects parents and caregivers, as they may have to take time off to stay home and tend to their children. This impacts their jobs, their coworkers, and above all, the economy of Pennsylvania. For months, our agency has joined the Pennsylvania Department of Health, along with state and national organizations, in recommending schools follow the CDC guidance. Secretary Beam's masking order is in alignment with the CDC guidance, and along with other layered mitigation strategies which will help keep our children in school, participating in sports and other extracurricular activities. So the Department of Education certainly extends their gratitude for the great leadership of Secretary Beam and her team for the commitment to fighting the pandemic and protecting in-person learning for Pennsylvania school communities. Similarly, I'd like to thank our school communities for everything that they have done and continue to do to ensure the safety of our children as they learn and grow in classrooms across the Commonwealth. The goal of our efforts remain to sustain in-person learning throughout the school year. We must do everything to ensure that we don't disrupt their learning, and we must come together for our children to keep them as safe as possible in school. So thank you for allowing me to be here. And at this time, I'd like to invite my colleague, Secretary Meg Snead of the Pennsylvania Department of Human Services, to the podium as well.
Good afternoon. Thanks, Noe. My name is Meg Snead, and I'm the Acting Secretary of the Pennsylvania Department of Human Services. I'm proud to stand here with my colleagues on behalf of the Wolf administration to announce action we're taking to help Pennsylvania children stay safe in their schools, childcare settings, and early learning programs. I'm a mom to 2 girls, ages 4 and 7. Like most Pennsylvania parents and caregivers, I've experienced a uniquely persistent anxiety over the past 18 months. Raising children in the context of a pandemic is difficult, to say the least. My family has followed the guidance of public health professionals since the pandemic started. We stayed home when that was necessary. We wear masks when we're around other people in public. And my husband and I got vaccinated as soon as we were able to. But my 2 girls are not yet eligible for the COVID-19 vaccine because they're too young. Like all other Pennsylvania children, my girls are living in a community where a dangerous virus continues to spread, a virus that has become more dangerous to children as it's evolved. As a parent, it's my job to do everything within my power to protect my children from danger. As a member of this administration and a public servant, I believe it's our responsibility to develop policy that protects all children from danger. The Department of Human Services licenses and regulates about 6,500 licensed child care providers in Pennsylvania. These are settings that are primarily serving kids in group or center-based settings. Since the start of the pandemic, DHS has been tracking COVID-19 cases associated with facilities and settings that we license, including child care providers. I can assure you that COVID-19 can and has spread in our child care centers. New cases of COVID-19 among children enrolled in a licensed child care have increased significantly in recent months, according to data self-reported to DHS by those child care providers. For example, on June 4th, child care providers across the Commonwealth reported 8 cases of COVID-19 for the week before. On August 27th, the number of new COVID-19 cases among children in child care the previous week was 162. While older people and people with pre-existing health conditions were clearly more vulnerable to early variants of COVID-19, this was never a virus that spared children or failed to spread among them. And as increasing cases of COVID-19 clearly demonstrate, this pandemic is not over. We have a responsibility as a Commonwealth and as individuals to send our children back to school safely and keep our child care providers open to working families who rely on them. It's my firm belief that we must follow the science and use evidence-based strategies to prevent the spread of COVID-19, like wearing a mask. Our collective health and well-being and the recovery of our economy depend on us making the right choices. A thriving childcare industry is foundational to the rest of our economy, and this industry and the dedicated educators who show up every day to help our children grow will be essential from our recovery from this pandemic. Simply put, without access to safe childcare, many parents cannot get back to work. That includes my husband and me, who could not go to work every day without knowing that our youngest is safe and cared for in an environment where she's growing socially and educationally. An early childhood education experience can shape a child's educational, social, and emotional development throughout their lives. Science has shown that the first 5 years of life are critical to brain development, influencing the trajectory of an individual's life for many years after. After the past 18 months, I think it's important that we reflect on just how critical it is that our children are able to get back into physical spaces where they can learn and socialize and grow. The Secretary of Health's mandatory masking order for individuals older than 2 in an indoor childcare space will ensure that they can do so as safely as possible. At this time, we're happy to take questions.
Thank you, Secretary Snead. In addition to our speakers, we'd also like to note that in attendance today are Acting Physician General Dr. Janice Johnson, Sports Medicine Pediatrician Dr. Christina Master, Infectious Disease Specialist Dr. Swathi Gotham, and Tracy Campanini, Director of DHS's Office of Child Development and Early Learning. We will now begin taking questions from reporters, and we ask that you please use the hand raise feature. Our first question comes from Justine McDaniel from the Philadelphia Inquirer. Go ahead, Justine.
Hi, thanks so much. Hi, Governor Wolf and Secretary Beam. This question is for you. What will you do if school districts, do not follow this mandate? And are you prepared for a legal or legislative challenge? Have you had discussions with the Attorney General's office, the legislature? Are you prepared for that?
Thank you for that question. I think that might be better answered by the Secretary of Education. So, Noe, you want to take that?
Thank you, and I appreciate the question. As it comes to enforcement, I just want to remind everyone that school districts are constantly in the business of enforcing policies that keep schools safe for learning for our students, right? And so throughout the pandemic, it's been our recommendation to a number of school leaders, particularly those at the building, to make sure that that's the enforcement measures that they begin to use with regards to getting students to comply. I think the enforcement measure that we rely on the most is the incentives, both to students and families, of what this creates in terms of an outcome. Continued sustained learning in the classroom for our students, which is extremely important. Thank you for the question.
Let me just add, I think, to that this is, we talk about local control. This is something that puts the decision-making and the enforcement in the hands of the parents and the school boards. I mean, they're the ones that are overseeing the enforcement of this. And in the end, what we all want is what they want, and that is to keep our kids in school, to keep sports being played. Those are the things we can't do if we don't do something like this. So thank you. Good answer.
Thank you.
Next question, sorry.
Thank you. Our next question goes to Maddie Cudahy from Fox 43. Go ahead, Maddie.
Hi, Governor Wolf. This question is about your message to many of the parents who will most likely react badly to this mask mandate. We have seen masking rallies at several school districts. What is your message to them? And what will the consequences be if they send their child to school without masks?
Well, I think the school districts will be in charge of making sure that the students do come to school with masks. But again, think about the world. If we don't do something like this, how are parents going to feel if their kids get sick? How are parents going to feel if their kids can't go to school because the schools are closed? How will the parents feel if they can't participate in sports because they don't have sports activities because they've been canceled? I think this should be something that every parent should actually react with great anticipation, because this is a good thing. This will be a good thing for their families, a good thing for them, good thing for their children.
Thank you. Next, we have Lauren Make from NBC 10. Go ahead, Lauren.
Governor, good afternoon. I just heard from a county that supports your mandate, the mask mandate. However, they said they really wish that this had been done earlier. Other states did do this earlier. It is now the time when school is opening. Why wait until right now when schools already have their plans in place?
That's a great question. Thank you. Not every school has opened, so there's still time. But yeah, this is something that you could argue is maybe past due, and other states have done this already. We actually tried. We actually tried. We sent out guides and said, we'd like to have the school districts take responsibility for this. Turns out right now, more than half of the school districts have not taken action. So then I sent a letter, which I think you've seen, a public letter to the leaders of the General Assembly to say, how about you take the lead on this? I mean, I want to be collegial in this, and I think we all ought to be working together. We all care about our children. Let's do this for the Commonwealth of Pennsylvania, for our citizens, for our future. They sent me a letter, I think it was public, that you also saw, that said they didn't want to do it. So this is where we are right now. I'm the one left holding the bag. I'm the one that has to make the decision. And this decision comes out of the Department of Health, the Secretary of Health's order. We are going to do it. So yeah, you could argue we should have done it. Pennsylvania should have done this earlier. Pennsylvania did not act as a state. I think the time is now to do it, and we are.
Governor, 3.5 weeks ago, you were in Philadelphia and you said the CDC is not mandating this, and neither am I, and that the decision should be left up to the districts. So do you no longer trust the districts to make this decision?
Well, as I just said, I do, and I did, and 3 weeks ago, that's exactly what I was saying. I think it was 3 weeks ago. And where we are right now, as you point out, with many of the school districts, I'm not sure what percentage, but probably most of them at this point open, that less than half of the school districts have some plan, whether it's a full plan or a partial plan for masking. So I said, I'm recommending that school districts do this. This is the right thing to do. This is the right thing to keep kids in the classroom. That's what we want, to keep kids learning. This is what the future of Pennsylvania depends on. We need to do this. And after 3 weeks, we have less than half the school districts doing it, so we need to do something else.
Thank you. Next, we have George Salas from WPVI. Go ahead, George.
Good afternoon, everyone. Just a little bit more clarity on what the penalties under the disease prevention and control are if school districts or people do not comply with this mandate.
Well, I think that as they say, the real penalty is going to be imposed by parents upset with their school districts for not doing the right thing by their children. And I think that is going to be the biggest. I mean, maybe there are other things that can be technically done, but I think the big pressure on school districts is simply to do the right thing by their students, by their teachers, by their staff members, by their school bus drivers, by the parents who send their kids to schools. That's, I think, the biggest and going to be the most important enforcement mechanism as we move forward.
Good, Governor, but some people are going to adamantly oppose this. I mean, if they don't see any kind of real ramification, they may not comply. So is there any actual penalty besides just the shame of not doing it?
I'm not sure why you say there's not evidence that this is important. I think that's why the good doctor has been here. We have a lot of evidence that this is really important, and we've seen that all across the country. So, and all you need to do is really look at what's happening in those school districts that are open that have not done this. You see games that have been canceled. The Secretary talked about that. We've seen schools where parents, their cell phones are pinging all the time with COVID cases that erupt in classrooms. I mean, you just got to look around, common sense. This is something that if we don't do this, we're not going to have a school year with kids in the classroom, and that's going to be a lost school year for our children.
Thank you. Next, we have Jamie Martinez from Spotlight. Go ahead, Jamie.
Hi, thanks for taking questions, Governor. Several districts have already been sued over their mandates, whether it's parents in support of them or against them. So, in addition to the emotional toll and canceling events or keeping kids out of class, this has to be putting a financial strain on districts if they have to keep dealing with these legal challenges. Can the administration give them any support or any guidance in that respect?
We'll certainly try. Let me turn this over to the Secretary of Education for some specific things.
Thank you for the question. And I think what you're alluding to is with regards to the liability, has any support being lent to the schools and being able to do that? We offer constantly feedback and input to our school leaders as they're navigating this difficult decision, right? And so with regards to the liability that many of them incur if they don't follow the order that is put in place, similar to the orders that have been put in place in the past as well, those are significant consequences that come to individuals, right? And so we want to make sure that many of them understand that. I understand sort of the premise of the question here with regards to whether the administration has done anything to provide support. We don't have a liability shield in Pennsylvania to protect folks, but we know that for many of them, doing the right thing is really top of mind as they navigate many of these things. And so I just want to put that out there as sort of the incentive around the kind of guidance and support we provide our school leaders around this.
And let's not forget that the federal government has devoted a lot of money to COVID, to suppressing the outbreak of COVID in schools, so there has been and will continue to be financial support for doing the right thing here by our students.
Next, we have Christian Havener from WJAC. Go ahead, Christian.
Thank you. Governor, I'm watching our comments here as, look, social media is not the place where you go for positive affirmation, but I'm sure, as you know, you'll probably hear that a lot of people think that a lot of these things are tyranny and, that this doesn't really help kids and all of that. So how do you overcome that message? Because I think as a lot of the people have been asking here in the questions before me is that, look, if you're saying this is a thing, but if it doesn't necessarily have it doesn't have weight behind it, and I think a lot of people are going to look at this as you're trying to. It's one of those things that people are who already are supportive of masks are going to keep doing it, and the people who haven't been are just going to go about as they have been. So how do you overcome that challenge of trying to enforce this to get more people to wear the mask? And are you prepared to do more things if this doesn't work?
Now, I'm not sure why there's pushback on this. I mean, it is something that everybody has to do. If a few people do it and not everybody, it doesn't really work. But if we don't do this, where does that leave us? Well, again, just look around. School events are canceled. School is canceled. Students are sent home to quarantine. Parents have to stay home away from work to take care of those kids while they're in quarantine. I mean, there are a whole lot of bad things that happen that we see every day. Just look around. And to say that doesn't happen, I mean, that's just closing your eyes to reality. That's what's happening. If we don't do something, we're doing something because we want to keep our kids in school. We want to have a future for Pennsylvania.
And are you prepared to go further if you need to, if this doesn't work?
I have every confidence that the schools out there will do the right thing by their students and the parents.
Thank you.
Thank you. Next, we have Dennis Owens from ABC 27. Go ahead, Dennis.
Hello, Governor. Thank you for doing this. I have a question of metrics. What exactly is the exit strategy? In other words, what are you looking for to say, okay, we can eliminate this mask mandate? And what happens if 3 or 4 school districts have still high transmission, but others don't? What can you tell me about when this goes away?
Yeah, we're going to be continually looking at this. We actually said that we're going to look at this in the first week of October. In the meantime, we'll be following the CDC guidelines. I mean, we are in an explosion of COVID all across the country, including among our children, and we need to address this as quickly as we can. And so we're doing that. But to your point, we will continue to come back to this and no later than the first week in October to see where we are. And again, what we're going to want to see is that this pandemic is going away, that our children are no longer threatened by this, that our education system is not threatened by this. We see that, and this will go away. But we're going to keep looking at that and starting in next month.
So will there be guidance, say, every month? Okay, hey, we're still on this and we're not. How do you see this playing out?
We're not going to. We don't have specific dates, but we're going to continuously look at this. I laid out the first week in October date just because I want to make sure you're saying I'm not just going to be looking at this and maybe we'll come back to it. We actually have a specific date there, and I can pretty much assure you that the Department of Health will be looking at this every day. I'm looking at it every day.
Thank you.
Thank you. Next, we have Jim Melwart from KYW. Go ahead, Jim.
I hear you saying the difference in numbers from July to now, but New Jersey and Delaware were able to get this in place 3 weeks ago. Here in southeastern PA over the past month or so, school boards have been dealing with a lot, not exaggerating when we say police have been called, meetings had to adjourn early, board members have had to leave the room for safety concerns. What do you say to them, to those members? And frankly, do you feel you owe them an apology, making them go through all that only to get here 3 weeks late?
In other words, I think there was an earlier question of maybe we should have done this sooner. We can get into that. We're doing it now. We want to keep kids safe. We've tried to figure out different ways to approach this. The goal is to keep children in the classroom.
Understand the goals, but specifically, what do you say to those board members whose lives have been threatened, whose safety has been threatened? Why couldn't this have been done earlier?
Well, as I say, the effort was done, I don't know how many weeks ago, in terms of saying to the school boards, make this happen. These are the CDC guidelines. I want to have you make do the right thing here. That didn't happen. Said to the General Assembly, you take this and run with it and do the right thing here. They didn't do it. So it's left to me. So yeah, maybe if we had all run together earlier, it would have been nicer, but that didn't happen. So I'm moving as quickly as I can here.
Thank you. Next, we have Charlie Thompson from Penn Live. Go ahead, Charlie.
Hi, Governor. In light of some of the previous questions about why you didn't do this sooner, I was also curious if you had a lot of internal debate in the administration about whether, in fact, you still had this power after the constitutional amendments were passed in May, and whether or not you could actually apply the disease prevention and control law to do something like this. Was there a lot of back and forth internally in the administration about whether you could move?
And let me just be clear, this is not coming from an emergency declaration on my part. This is coming from an order that comes from, you said, a 1929 law that gives the Department of Health the ability to look at the general health and welfare of our schools, including cafeterias, cleanliness of classrooms, all that kind of stuff. This is part of the power that exists there, and this order is coming from the Department of Health.
But were you worried about whether you could actually use that law to take this kind of a step?
No.
Okay.
Thank you. Next, we have Mike Rubenkamp from the Associated Press. Go ahead, Mike.
Governor, I was about to ask you why you believe your administration has the legal authority to issue a statewide mask mandate, but I think you just answered that. You say that it has nothing to do with the emergency disaster declaration.
It comes from the Department of Health, and it's a power and authority they have had since the late 20s, early part of the 20th century.
Thank you. Next, we have Josh Byers from the Tribune Democrat. Go ahead, Josh.
Hi there. Thanks for taking my question. Hey, I was just wondering, do you expect the members of the legislature to try and overturn this order? And if they're successful, what's the plan after that?
I'm not sure how they would do that, so I'm not expecting that. I'm not expecting everybody in the General Assembly to be pleased with this, but I think that everybody recognizes this is a difficult decision. It has to be made, and I applaud the Secretary of Health for making it. I think they will too.
Thank you. Next, we have Madeline Hanna from the Philadelphia Inquirer. Go ahead, Madeline. Okay, next we have Tom Lehman from WGAL 8. Tom, go ahead.
Governor, I know there were a lot of legal challenges to some of the orders that were put in place under the Disease Prevention and Control Act. Specifically, I'm thinking about the Stickman ruling, and I understand that was sent to appeals, and I understand that very recently that was sort of shelved, but that was not, my understanding is the ruling there was not that we're ruling on the merits of the case. So I'm wondering, are you concerned that there may be some kind, I don't want to say legal precedence, but there may be some argument that this could be brought to court and taken out through the judiciary system?
No, I don't think so. I'm not a lawyer, but I think the Stickman case was overruled by the Circuit Court, Third Circuit. I think if you actually, and again, I want to point out, this is not a legal opinion, I'm not a lawyer, but I would think that if a state can't do this, if a community can't do this, then what justification is there for setting up stop signs or traffic lights or traffic rules? Or other rules of safety. I mean, I think one of the reasons government exists is to protect us, to protect our communities, protect our neighbors, our society. And that's simply what this is intended to do.
Thank you. That's all the time we have for questions today. We'd like to thank Governor Wolf, Dr. Trudy Hecker, Acting Secretary Beam, Secretary Ortega, Acting Secretary.
And you've been listening to Governor Tom Wolf and members of his cabinet lay out their plan for a mask mandate in K-12 schools and daycares as the new school year is underway across most of the state right now. Now, the mask mandate takes effect on Tuesday, September 7th. That is the day after Labor Day, and the mandate is issued under the authority of the State Department of Health. Students, teachers, and staff will be required to wear masks when indoors. Student athletes will not have to wear masks while they're playing. Now, the order does apply to public and private schools and child care facilities across the Commonwealth. The two statewide teachers' unions had been pushing for masks in schools because of the threat of the COVID-19 Delta variant. Now, this mandate also includes all visitors to schools, regardless of vaccination status. Governor Wolf ruled out mask mandates about a month ago. However, as cases of the Delta variant surged, the governor then asked the General Assembly to pass a school masking bill. Lawmakers declined, and that's how we got today's announcement in authority by the State Department of Health. Here is a look at the new COVID-19 case data for Pennsylvania. There were more than 3,200 new cases as of midnight. More than 1,800 people are hospitalized, with more than 470 right now in intensive care. In South Central Pennsylvania, Lancaster and York counties currently have the most cases. Lancaster with 228 and York with 152. Later on Fox 43 News, first at 4 and at 5, expect more on the school mask mandate, what people for and against it are saying. Plus, we are keeping you weather smart ahead of tomorrow's significant rainfall coming in from Ida. We'll tell you how local emergency responders are preparing. And the crisis in Afghanistan continues after the last American left. What the president